Dr. Avish Nagpal is from Sanford, and he is an infectious disease specialist. Dr. Nagpal, good to have you back coming down the road with us.
Hi, Joel. How are you?
I'm doing well. I'm doing really well because, Dr. Nagpal, I've been vaccinated. Okay, that's one of the reasons I'm doing very well. I don't get up in the morning and have to worry about being one of those individuals in the hospital who chose not to be vaccinated. Where are we at in terms of the Omicron and where we're at in North Dakota in terms of vaccinations, Dr. Nagpal?
Yeah, so, we continue to be in a worrying place. As I said last week, the next 3-4 weeks are going to be painful. If you look at the trend in North Dakota, we have reached the peak that we were at last winter. Now, the good thing is that overall, nationally, if you look at the trends, we may be closer to a peak because we are at about 4 times the number of cases. And that's the average that we have been seeing over different countries where Omicron becomes widespread. So in North Dakota, we expect that we might peak in the next 2 weeks, but we are nowhere close to the peak right now. We have matched the previous peak, and we expect to go 3 to 4 times higher.
So let's talk a little bit, if we can, about people's perceptions of Omicron, what's true, what isn't. And here's what I get hit with a lot, whether it be people who watch this show or listen to me on my radio show. They say that Omicron is one of those variants that is really going to solve COVID because you don't get that sick from it. And because you don't get that sick from it, and because it spreads so rapidly, and because so many people are going to get it, that natural immunity then is in place. I want you to get a chance to visit with people about that.
We have been trying to rely on natural immunity for the last 2 years, and we have gotten nowhere with that. And it's not going to change with Omicron. I think so. There is some point to the fact that it is a relatively milder variant, but keep in mind that it's not a common cold. When we say relatively mild, it means it causes 50% of the hospitalizations. So do the math. 4 times the cases, 50% of hospitalizations, we will still see the number of hospitalizations that are double the last year's. So do not underestimate it. We are not doing ourselves any favors by saying that this is a mild disease. It is not for people who are not immunized and people who have underlying medical comorbidities. And we are in a very difficult place. We have so many cases right now that there are practically nothing we can do at this point in time to stop this spread, to stop this explosive growth in cases. And add to that, the treatments that we rely on, like sotrovimab and the oral antiviral pills, they are in extremely short supply right now, to the point where we had to close down our infusion center because we did not have the drug. So do not underestimate the power of this virus.
So, okay, so we need to take this serious, but it does spread very rapidly. There's a lot of people who say that, you know what, why should I be vaccinated when you, Joel, let's use me as an example, can get it too. You can spread it too. What's your answer to them?
Yeah, but you are not going to end up in the hospital if you're vaccinated, and you are not going to rely on the treatments that we don't have. So, the primary prevention is vaccination, and prevention is always better than cure. That fact doesn't change with the variant that we are dealing with.
So do you believe that when Omicron's done, that really what we're looking at is everyone in this country will have had it? That when it comes to COVID, this is the one that takes us to a point where, we've all had it. We can move on with our normal life.
No, we'll need vaccination. That is a wrong strategy, relying on natural immunity alone. The reason being, we are seeing a lot of reinfections right now. Even in people who had Delta about 3 to 4 months ago, they are coming down with Omicron. And if you have an immunocompromised immune system, or you have underlying medical conditions, don't rely on natural infection alone. Just like the vaccine, the immunity will wane over time. So if you are eligible for a booster, or if you haven't started your primary series yet, go ahead and do it. this is a very dangerous time right now for people who have not been vaccinated and have underlying medical conditions.
What about the hospital staff, doctor? I have friends that work at Sanford where you work, and they've had it. I mean, they've had it. They can't understand it. These are people based in science. They're people based in medicine. They're passionate about their job because they took the job to help people. Many of the nurses I've spoke to, I'm not saying that they're like, why should I help you if you're not willing to get vaccinated? I just know they're wore out. Speak to that if you would.
Yeah, we have been dealing with this for 2 years, and we are kind of in a different position. If you don't have staff, if you don't have some supplies, you can close down a business or tell your customers to come some other day. We don't have that luxury. We cannot turn anybody away. We cannot refer anybody to an outside hospital. There are no beds at University of Minnesota. There are no beds in Bismarck. There are no beds at Mayo Clinic. So there is, if somebody comes in, they need medical care, we have to give it to them. And we expect to be at a point in the next few weeks where even if you have COVID and you have recovered slightly, you are still not feeling up to the task. Healthcare workers might have to show up for work.
I'm looking at the latest, and this is how old I'm getting, doctor. I got to get my readers on. But I'm looking at the latest stats sent out by Sanford. Of the 201 that have been hospitalized, 176 are unvaccinated. Of the 64 in the ICU, 57 of them have been unvaccinated. Of the 51 that are in total in your care that are on ventilators, 46 haven't been vaccinated. To me, this is a numbers game. And I've been trying to tell my audiences that, look, if you had, put it in terms of what they might relate to. If you had this casino and you had a 95% chance of winning versus this casino and you had a 5% chance of winning, which casino are you going to go to? I mean, this is a no-brainer. And so all these individuals that are out there talking about, that continue to talk about why the vaccine is dangerous to you and why taking that vaccine could have long-term issues, long-term problems. This vaccine has been out there for a while now. People are having babies. The fertility issue is not a question. People haven't come down with cancer because of it. I mean, I guess what I'm getting at is all these negative things that are being said about it, the longer the time passes, the more it's proven that they're not true. And so what type of effect is that having? Are you seeing some of these naysayers now say, okay, I get it, or are they just never going to get vaccinated?
No, Joel, it's a little bit more complicated than that. The excuse changes. You have a study, you put that study out. The first reaction could be either you could deny that I don't believe in that study. How do you argue with that? And the second is that because many of the people who remain hesitant about the vaccine, their reasons are complex, and some of them actually, see vaccine as government overreach, somebody telling them what to do, and you're fighting their worldview about that. So it's a little difficult. We have had problems convincing people. We continue to engage them in conversation and continue to be empathetic and answer their questions in the best way we can. Try to continue to provide reassurance. But this is a hard needle to move, and you are seeing the effect right now. Many countries reported that when Omicron took off, their hospitalization rates did not increase. And these are the countries that had in excess of 90%, like Portugal or UK or Israel, who did nationwide boosters. And we haven't seen that uncoupling effect here. As our cases have increased, our hospitalizations have increased hand in hand. We don't have that luxury.
So last question, doctor, and it's a tough question, a question that not a lot of people want to go down, but I get out there. I talk to a lot of people in the public, and I believe from talking to many of the individuals that one of the reasons that they don't want to get the vaccine is because there's strong belief in what they describe as pro-life. They think that the vaccine was developed through fetal tissue, and because of that, they think that it goes against their very core belief. Have you heard that from the people that won't get vaccinated?
Yeah, some people do mention that, and I tell them that you always have a choice of getting the mRNA vaccine. These are not directly derived from fetal tissues. Some of the earlier experimental testing on the adenovirus-based vaccine involved working on fetal tissues, but the mRNA vaccines did not have that step. So, if that's your concern, you can always get the mRNA vaccine, which is the Pfizer or the Moderna vaccine. And those are both more effective than the adenovirus-based vaccine, which is the Johnson & Johnson vaccine. So if that's the concern, then you have not one, but two options, which are actually more effective.
And I just want to ask one last question because I lied. I got one more in me. Was ibuprofen developed through fetal tissue?
Yeah, so most of the medications that are developed at some point of time, they have to be tested in a petri dish, and there are only limited amount of ways you can test or develop the drugs and see the effect of the drugs in a petri dish. And we have a couple of cell lines to that we can use for this, and not directly aborted fetal tissues, but the ones that were that we had from like 60s and 70s are the ones that we use, and we have propagated it over a long period of time. So yes, it's not just the vaccines. The medications that you use on a daily basis may have used those aborted fetal tissue from a long time ago in their development as well.
Dr. Nagpal, keep up the good fight. I mean, you're doing what's right. You're trying to help people. If they don't listen, it's not your fault. But do what you can, because, getting this behind all of us, I think, is what the goal is. And I appreciate you coming on and trying to get word out as much as what you can.